Today we're doing a vampire facelift, and a brief explanation of what a vampire facelift is. Basically, the idea of lifting the face is what leads to some confusion. As a cosmetic surgeon, I perform facelifting routinely. And what am I doing? I'm routinely vertically lifting the face. That means lifting the skin upward. Now, instead of lifting upward, the vampire facelift concept is more about lifting the skin outward. Now, why is that? Well, because as we get older, we lose bone, muscle, and fat. And so the face starts to go inward. We start to see more of the skeleton or the structure of the underlying part of the face.
Over the past few years, I've noticed that my skin doesn't quite feel smooth and bright as it used to. I've noticed there's certain small indentations that are beginning to appear, particularly under my eyes and the areas around my nose and lips. And these are the kind of issues that I would like to address, but at the same time without getting the very obvious artificial look. And this is why I'm really looking forward and very excited for the vampire facelift.
So what the vampire facelift is doing is we're adding hyaluronic acid and platelet-rich plasma in a unique way to restore volume in areas that need volume. As you get older, when you hit your mid to late 30s and beyond, you start to lose areas of volume and fat particular, such as the lateral part of the eyebrow or the outer part, the tear trough area, the under eye area, the cheek area, the nasolabial fold, also called the parentheses lines, the outer corner of the lip. So the concept of vampire facelift is to literally take one syringe of a hyaluronic acid filler such as Restylane, Juvederm, Belotero, and use that very strategically. So this way we avoid an unnatural overinflated effect. And for people who are in these early stages of facial aging, they don't need very much. The idea of using platelet-rich plasma is really very inspired. The platelet-rich plasma stimulates healing. So it increases blood supply and collagen. Think about it like when you get a cut, the area where you got the cut heals by generating collagen and new skin cells. So what we're doing is we're kind of manipulating that healing response and placing the PRP and stimulating new collagen and blood supply to the area that needs it. Now, the synergistic effect of hyaluronic acid and platelet-rich plasma has been very well documented in wound healing. And so this is the benefit that we get really nicely with the vampire facelift. So our plan today is to add volume in the areas where she needs volume doing the vampire facelift. So we're going to start first with a hyaluronic acid filler. So this happens to be Restylane, but you can use Juvederm, Belotero, any filler that you're comfortable with. So what we're going to do is first start by identifying where the opportunity is. Now, to me, her lateral brow is already very nice and high, so we're not going to place anything in lateral brow. I think we have an opportunity right here in the tear trough area, in the hollows. She's already had topical anesthetic, and so she should be relatively comfortable. I'm going to ask her to rest her head back so she doesn't feel the pressure to stay steady, and we'll start placing. Bring your chin up, okay? Okay, and so now we got this area filled in kind of very nicely. It looks very natural, and it's blending in very well. Okay, chin down, okay, and look at me. That looks good. That looks really nice. Very good. Can now rest your head back. Next, we're going to approach the nasolabial folds, sometimes called the parentheses lines. So turn a little bit towards me. Okay. perfect. That's really nice. That looks really good. Okay. And now we'll do a little bit to give a little bit of an outer corner of the lip lift. Turn towards me again. Okay, that looks really nice. Now we're using the platelet-rich fibrin matrix. So this is from the blood, and it's taken, all the red cells have been taken out, and this is what is the key to the healing factors and the growth factors necessary for building collagen and improving blood supply. So it really takes it up to another level to have this synergy between the platelet-rich plasma and the hyaluronic acid. So we're going to place it right under the skin. Small amounts. The idea is that we want to minimize any type of distortion. So conceptually, someone can go about their normal day as long as we avoid any obvious little bruises. And most of the time it's easy to cover up with a little makeup anyway. And what's nice about the PRP also is that it goes into the skin and it naturally just flows and it smooths out very well. So it's not like a filler where there's a lot of thickness. It has some body to it because it's a fibrin matrix, but it won't create any lumpiness or irregularities. We've used PRP very successfully in our practice for skin rejuvenation, for acne scars. We're using it in combination with extracellular matrix for male and female pattern hair loss. It's been really great. Okay, so let's take a look at how we look with the PRP and the Restylane together.
Wow.
That looks really...
Yeah, what an amazing difference.
Looks really good. Looks really good. I mean, there's volume here. It's a little bit exaggerated at this point, but it's going to blend in and settle in, and the synergy will be really beneficial.
No, I love it. Yeah.
Looks
Thank
really
you so
good.
much, doctor.
You're welcome.